Now we start the operation guide for HIFU treatment. First, customer need to sign the informed consent form. Then inform the client what are the contraindications to this treatment, also informing the client of postoperative precautions. The customer knows and signs that the treatment can be start before the formal operation to the customer for makeup removal cleaning. Now for line draw guidance. Because our HIFU can reach our fascia layer, so you need to avoid some sensitive nerves during the treatment. Due to our faces being curved, so we need to use a soft ruler and a specific drawing pen. We need to draw the forbidden area first. The first one is our mandibular margin nerve. You can use your thumb to draw a dot at roughly 1.5 centimeters distance. Then draw a straight line from this dot. Then draw a straight line according to the highest point of our lip peak. Here is the area of our mandibular border nerve that could not be treated here, cartridges 3.0, 4.5. This is where our mandible is located. Do not operate directly on the mandible. You can lift the skin upwards when manipulating this area. This is the location of the ototemporal nerve and a finger wide is about 1.5 centimeters apart. Draw a straight line. We do not recommend treatment here, cartridges 3.0, 4.5, 1.5. Then there is the orbital bone. Need to touch the client the bone under the eye that the orbital bone cannot be treated, cartridges 3.0, 4.5, 1.5. Draw an arc along this bone. Here is the superficial temporal nerve. Draw a straight line from this location to our hairline. Set a point at the brow bone and then set a point about 2.5 centimeters away from the line. Then connect the two dots. Then draw a straight line from about 15 degrees up. This is the area of the superficial temporal nerve that cannot be treated, cartridges 3.0, 4.5, 1.5. Then here is the supraorbital nerve. The customer needs to open his eyes and look straight ahead first. Draw a dot from the midpoint of the eyeball corresponding to the eyebrow. Draw a straight line from this point up to the hairline. This intermediate area is the supraorbital nerve that cannot be treated, cartridges 3.0, 4.5. These areas need to be avoided. In addition to cartridges 3.0 and 4.5, we have a cartridge 1.5. It can reach the shallow layer of our dermis, so some parts can be treated with it. So where can we use it? Here can be treated with cartridge 1.5. However, the corners of the mouth up to here are not recommended to be treated with cartridge 1.5. This area can be treated with the cartridge 1.5. The midpoint of the eyeball to the brow position in this area is not recommended with cartridge 1.5. But this area in the middle can be treated with cartridge 1.5. It is easy for us to operate after drawing the auxiliary line. The first auxiliary line, draw a dot at the midpoint of the edge of our nose. Draw a dot on the highest point of the cheekbone. Here is a fixed point. Connect these three dots. The purpose of this line is to distinguish the location using the cartridge 4.5 operation. Below this line is what can be treated with cartridge 4.5. Areas above this line are not recommended for treatment with cartridge 4.5 because there is less soft tissue of skin above this line. Then, after drawing this dividing line, draw the auxiliary line with the cartridge. Now for where the energy emanates from the cartridges. It's the two vertical lines on this side and the two vertical lines on this side. The middle area where they meet is where the energy is emitted. So, we have to draw the grid according to the area of the energy coming out. You can draw the dots on both sides using the cartridge. After finishing the dots, you can draw a straight line. This is a guide diagram for the corresponding area of the cartridges. After drawing the line, you can put the gel on. Because the ultrasonic energy is required to be the gel for conduction, you can tell the customer that the feeling will be a little cold before applying it. It's about 3 mm thick. In the process of operation, if the gel is found to be not enough, it needs to be applied in time. Now, we can adjust the treatment parameters. Here is the length and width of the energy output. If you want to operate more efficiently, you can shorten the time. That can adjust the energy length and width to the maximum. This is also the largest range of energy output. When you want a better effect of lifting, or if the client has a lot of loose skin, so the more dense of the dots is better. Then, at this time, the distance between the lines and the distance between points to a minimum. At this time, the hit point is the most dense. Here you can see 12 lines with a total of 300 points. If the customer is afraid of pain or the customer is relatively young, you can adjust the density to be larger. The parameter adjustment is based on the customer's tolerance and the degree of skin relaxation. This is the energy value. We need to do the skin test for customers from low energy according to our parameter suggestion table. Here is the depth of the cartridges. Remaining number of shots, total number of lines of treatment, number of points of treatment, and the serial number of the cartridges. The following area is where you can store the parameters. If the customer feedback is good, the parameters of this treatment can be stored. Next time the customer gets to the store, you can click here. Conveniently, the parameters you want are directly shown. Here is the fast mode and the slow mode. In fast mode, the dots are played faster. Instead, the slow mode means the dots are played slower. Fast mode will be more efficient, but it will feel more painful. If the client is not afraid of pain, he can choose the fast mode. If the customer is very afraid of the pain, choose the slow mode. Here is the start key, pause key, and go back to the main interface. Wipe the probe slightly with alcohol pads first. Now is the guide to the operation. The first point, cartridges must be vertical to the skin and close to the skin, can't hollow out or tilt. The second point is where our muscles are going. So the operation is from the inside to the outside according to the grid. Before starting the treatment, you need to tell the customer how the feels about this treatment. Probably is sore pain. Cartridges needs to be placed on the skin first and then click to start. Don't click to start first and then put it on the skin. You need to care more about the feelings of customers when asking about customers. Also need to observe the skin reaction. If it is particularly red, the proof energy may be too high. It's time to reduce energy. Here you can put your other hand in customer's temple to do a little lift. You have to wait for a line of energy output before moving for the next position of the treatment. After operating the area of cartridge 3.0, we can treat with the cartridge 1.5. The cartridge 1.5 operation also needs to be placed vertically on the skin and close to the skin. You can slide the treatment or slowly move to treat. Its energy output is at a point in the middle. This is the cartridge depth. This is the count of this operation. This is the total number of cartridge. This is the remaining number. This is start, this is pause, energy and frequency. Also, according to our parameter suggested table, starting from low energy. This frequency represents the speed of movement. When the frequency is tuned very high, the movement has to be faster. If the frequency is down, you have to move slowly. Place vertically on the skin and stick close to move in circles or move slowly. Since it only has energy for one point in the middle, it probably moves about 1 millimeter or so at a time. This area can be operated horizontally and then vertically. If the client chooses the double chin area treatment, here is the chin line guide. Draw a dot on the midpoint of the chin. Draw a dot on both sides of the mandible and practice the 3 points into a triangle. Then use the cartridge to draw the auxiliary line drawing grid. It is also convenient to operate according to the grid. You can operate from the middle to both sides and then from the bottom up. If the customer is particularly afraid of pain, after using cartridge 4.5 from the middle to both sides of the operation, you can change the cartridge 3.0 from the bottom up operation. It is just as necessary to apply the gel first, and then you can follow the grid stamp style. In the middle, there is a thyroid cartilage that needs to be avoided. In addition, the cartridge is the way up. Do not operate the skin vertically in this direction. For the treatment of the double chin area, we'd better operate at this position on the customer's mandibular line. The neck is also operated, because the mandibular line goes up and then the neck skin goes down like this. Customer's double chin can get a better tightening. If do a double chin alone, it will still go down and the jawline here will be less effective.